Okay, good morning everyone. This morning I'm joined by the Transport Minister David Elliott, the Roads Minister Natalie Ward, our Chief Health Officer Dr. Kerry Chant, the Deputy Secretary of New South Wales Health Susan Pearce, and the Chief Operating Officer of Transport for New South Wales Howard Collins. Can I begin by extending my condolences to the families with COVID. Our thoughts, our prayers and our hearts go out to all those families at this difficult time. Can I also thank our health workers once again who are on the front line day in, day out, providing care and support for people right across our state. From the cities to regional and remote New South Wales, our doctors, our nurses, everyone involved in our frontline health system are doing an amazing job after what has been a challenging 2 years to continue to move through this phase. And on behalf of everyone in our state, can I thank you all for the work and the support that you're providing people in our health system throughout our state. Today, as we do every Friday, we are releasing how we are tracking in relation to hospitalisations and ICUs across our state. It's pleasing to say that we are tracking within capacity and the trend is in a positive trend as well. That obviously does not mean that our health system is not under pressure. We continue to be under pressure like all health systems around the country and around the world. But there are some pleasing signs that continue to come through the modelling, particularly when you look at the best case scenario that we put out a few weeks ago. In addition to that, what is also providing greater support for the health system at this time, you might recall a few weeks ago we had around 6,000 furloughed health workers across our state that was putting a strain on the system. Today that figure is at around 3,700. So we're having many frontline health workers being able to return to our health system to continue to provide that care and support for people who need it across our state. I want to touch on schools, and obviously we're here to make an announcement in relation to the return to school transport plan today. But I can announce today that every school across New South Wales that starts next week has now received their rapid antigen tests. This has been a phenomenal effort. It has been, as we've said, a military operation. We set out to achieve this a few weeks ago. We always thought it would be a substantive challenge, not just in the procurement of these tests, the distribution right across New South Wales to schools, public schools, independent and Catholic schools. It's over 3,000 schools right across New South Wales that we've been able to distribute these tests to, as well as 5,000 childcare and early childhood centres across the state. So it has been a mammoth effort. I want to thank and congratulate everyone involved, whether that has been a Department of Education teams who have volunteered their times on weekends to help package, to help organise this distribution in a way that would ensure that every child in every school and every teacher has access to these tests. We have worked alongside the Victorian government to achieve this outcome. We're the only states in the country that have been able to achieve this program due to the fact that we went out and procured a substantial amount of these tests. But it should give confidence, a lot of confidence, to parents and to teachers that when we open up schools day one, term one, we are doing so in a safe way for you and your family. I want to congratulate everyone involved, and I want to thank our principals right across the state, who, when we obviously raised this with them and the task that was at hand, they have played their role in distributing those tests to parents. Those tests are required twice a week. We obviously don't stipulate the date. This is about being flexible. We know parents are busy. We know getting back to school on day one is a challenge for all. I certainly know that, having 4 kids going back on Monday morning. But we have done so in a way that should provide confidence and be reassuring to parents and teachers across the state. And I want to thank and congratulate everyone for this effort. It has been a military operation, but to see where we are today, to have every school that starts next week having those tests distributed, and I want to thank the principals who are now distributing those tests to parents. But one final point I'd make there is, if you are a parent And obviously every school is different and you can't pick up your tests on day one, don't worry. The schools will provide your child with those tests as school commences. We obviously want as many parents as possible who are able to go and pick up those tests before school starts. Please do so. If you can't, for whatever reason, don't worry about it. Those tests will be available when you come to school on day one. Next point, transport. So I'm here joined today by the Transport Minister, David Elliott, and also the Roads Minister, Natalie Ward, to talk about how we're getting kids back to school safely, not just in the classroom, but with transport as well. From the start of school, we'll have 3,400 buses on. An extra 200 train services will also be put on for students to get them back. Those 200 extra train services will be for the school peak hour, both in the morning and in the afternoon. There will be COVID-safe arrangements that are in place, which the Transport Minister will speak to as well, just like we had at the end of the year last year. So that includes, if you're over 12, face masks on public transport and the like. But once again, whether it's our schools plan, our back to schools plan, a key component of that has been transport as well. So this should give confidence to parents right across the state that the provisions that were in place last year, when it came to getting your kids back in the classroom safely through the transport services, that they'll be resuming as they were last year. And both ministers and obviously Howard Collins will speak to that as well. The final point I'd like to make today is, as I always do, is in relation to boosters. Please, if you have not made an appointment to get your booster shot, please go and do so. We have 40% of the eligible population across our state who have received a booster shot, and we have substantial capacity in our 40 hubs across New South Wales for those booster shots to be administered. So we know many will receive that vaccination through your GP and your pharmacist, but our hubs are here to help. We have many people working tirelessly this entire pandemic who are there to provide that booster shot at those vaccination hubs across our state. As we said yesterday and last week, we had 100,000 appointments that we could have carried out that people did not attend or did not make that booking for. So can I say to everybody across the state, it's very clear on the evidence here, on the evidence around the country and evidence around the world, that boosters work in ensuring that you're kept safe during this period of time. I know many people have made a substantial effort over the last 2 years in going out and getting vaccinated. I know many people are tired, but this is one last effort we all have to make to keep us safe during this period. And so can I please ask, if it's been 3 months since that second dose vaccination, please make an appointment, either at your GP, your pharmacist, or at one of our hubs across our great state. Once again, can I thank everybody right across our state. We are doing incredibly well, and that is because of all of you and the efforts and the sacrifices you have made. We can continue to treat people with kindness and respect, the way that we've done so over the last 2 years. We will ensure, as we have in the past, our state will come through stronger out the other side. I'm now going to pass to Dr. Kerry Chant, who will provide a public health update. Susan Pearce will then provide an update in relation to our vaccination program and boosters, and also speak to the modelling that we are releasing today. Minister Elliott will then provide some further details in relation to our back-to-school transport plan. Minister Ward will then speak to the transport plan as well, particularly in relation to road safety, because as of today, our school zones are back on. And then Howard Collins will provide some further information in relation to transport across the network.
Thank you, Premier. There are currently 2,737 people in hospital, including 189 people in ICU, of whom 78 are ventilated. There were 13,333 positive tests returned in the 24 hours, including 7,077 positive rapid antigen tests and 6,256 positive PCR tests. Those positive PCR tests, that 6,256 positive PCR tests, were returned from 37,463 PCR tests. So thank you everyone for continuing to get tested, and please remember, if you've got symptoms, please stay at home and get a test. Today I will be giving more details, as I do on the weekly summary of the deaths, to give people a sense of the underlying vaccination conditions that people are dying with COVID, and also the vaccination status. But before I do, I'm announcing that there's 35 people have sadly died of COVID in the last 24 hours, 20 men and 15 women. Of the 35 people who died, one person was in their 40s, 2 people were in their 60s, 6 people were in their 70s, 11 were in their 80s, 14 people were in their 90s, and 1 person was more than 100 years old. Can I pass on my condolences to the families for their loss? 8 people had received 3 doses of a COVID vaccine, 15 had received 2 doses, and 12 people were not vaccinated. We're also today announcing an additional 35 deaths that have occurred in the period from the 2nd of January through to the 20th of January in aged care facilities in southwestern Sydney. You can imagine that this has been a very busy time for southwestern Sydney, when they're experiencing quite a number of cases of COVID, and we've had a number of outbreaks in aged care facilities. And so whilst the local health district has been working with the Commonwealth and the aged care facilities to support and focus on the response, there was a delay in reporting those deaths to the ministry for the purposes of the statewide reporting. In the media release, it details the dates on which those deaths occurred, and they're from that 2nd of January through to the 20th of January. We have reached out to all our other local health districts to ensure that the processes are streamlined for the reporting to the statewide reporting purposes, and we've been no additional issues have been identified to date. So can I also pass on my condolences for those who have lost their loved ones. In terms of the summary of deaths for the last week, from the 21st of January through to the 27th of January 2020, and these do not include the additional 35 that we've indicated. There'll only be a small overlap with that on one day, being the 20th. But of those 210 deaths in the last week, 192 were in people over the age of 65 years. 43 of those died in aged care facilities, 147 died at hospital, and 2 died at home. Of those who died at home, there was a gentleman in his 60s and a gentleman in his 80s. 1 was not vaccinated and 1 had received 2 doses of the vaccine. In terms of the 18 deaths that were reported in those under 65 years of age, 1 person was in their 30s, 2 people were in their 40s, 10 in their 50s, and 5 in their early 60s. 8 of those 18 individuals were not vaccinated. And the 1 person who died that did not have significant comorbidities was in that unvaccinated group. So 8 were not vaccinated, 1 had 1 dose, 8 had 2 doses, and only 1 had received 3 doses. So again, it stresses the importance of the booster dose for protecting you, but also protecting those around you. I'm also going to give you an indication of the significant comorbidities. Now, this is challenging because people often have multiple underlying conditions. So when I report the numbers against each category, it will mean that some people are in multiple categories, so the numbers won't add up to the 18. But 2 had significant cardiac disease, 2 had significant obesity, 3 had chronic pulmonary disease, 1 had asthma, 4 had diabetes, 2 had chronic kidney disease, 1 had severe liver disease, 6 had cancers, 1 had severe mental illness, 3 were on a palliative care pathway pre-COVID, and 3 had some very rare genetic severe conditions. So obviously it is tragic to see that loss, but again it highlights the importance. We want everyone to get boosted, but I particularly want people who have got chronic conditions affecting their neurological systems, their hearts, their lungs, their livers and kidneys, or that are overweight or obese, to get vaccinated, and the elderly to get that booster dose. We know for greatest protection against the Omicron variant, we need that third dose. So please do not delay. And please, we always assume that information's got out very widely. But I think we who are engaged with COVID day in, day out, forget that many members of the community may not have had the opportunity to hear the message that the booster is recommended for 3 months now. The interval's 3 months. So can I urge everyone in the community to just check with your loved ones, check that they've heard that message, and really facilitate them getting the vaccine as soon as possible.
Just to start with the booster doses, we had a good discussion yesterday afternoon with our colleagues from the Department of Customer Service, and to pick up on Dr. Chant's point, what they told us that were around 50% of respondents to one of their recent surveys hadn't realised that they were actually eligible now for their booster dose. So if it is 3 months since you've had the second dose of your vaccine, you are now eligible. And I think it's really important, as Kerry said, please check with your friends and family. I was in a taxi this morning. I asked the taxi driver had he had his booster. Take every opportunity to talk to people around you about whether they are aware that 3 months after your second dose is time. We're ready for you, so please come forward. It is pleasing to see the rates climbing up, but as we've said repeatedly, we certainly would like to see those get higher. The other piece of feedback that we received yesterday from our colleagues at Multicultural New South Wales and some of our other agencies that we were working with is that people in the community think that because Omicron is more transmissible and people will get it in larger numbers, that there is no point having the booster. Nothing could be further from the truth. The reality of it is that for some people, Omicron will be a very severe illness. The vaccines help to protect you from severe disease, and that is the key reason why we are urging people to please come forward and have your booster. With regard to the hospital modelling that we've released today, you'll see that the hospitalisation numbers have certainly plateaued, as we said last week. We do think that in the coming week we will start to see them drop, and of course they may not follow that lovely curve that's on the page, but and it may be a bit lumpy, but we do expect that in the coming week we will start to see some declines. Pleasingly, the ICU number remains under the most optimistic scenario, but again, to state the point, our hospital system is working very hard. And we are very grateful for the investment that has been made in our health system over many years. But part of the reason that it is working in New South Wales at the moment is through meticulous planning and effort of our health staff. Every day, our health staff, doctors, nurses, allied health, our cleaners, porters, everyone in the system is getting up, going to work, putting on PPE and doing a hard day's work to protect our community and each other. We have to acknowledge them and the work that they're doing at the moment, and we do pay respect to all of our health workers out there, including everybody in the primary care setting. There are tens of thousands of people at the moment who are being cared for safely at home with COVID. And again, Omicron did present us some new challenges, but we rose to that challenge to help people safely care for themselves at home with this disease. And our teams in those community settings are working very hard to do that. We're closely looking presently at our elective surgery plans. We'll have more to say about that in the coming week in regard to what we do. But please know that as soon as we can safely resume non-urgent surgery in our system, we will do that. But we have to be cognizant of the pressure that the system's under and make the right decision in the interests of both our patients and our staff.
noting that this is my maiden press conference as the Transport Minister, can I start by congratulating and thanking Howard Collins for the work that he's done since the beginning of December under very, very difficult circumstances. The reason why Sydney Transport has maximised the experience and minimised the interruptions is because of the logistical skills of Howard, and I think it's important that as a government we recognise that work. Can I also acknowledge and thank the frontline workers of our transport system. Over the course of the last month I've made a couple of clandestine visits to train stations and ferry wharves and bus interchanges, and I've spoken firsthand to many of those frontline workers. Many of them, as I said, have been exposed to the virus. Morale is high. I think they love Sydney. They just want to get Sydney moving again. I also thank their agility in making sure that they've been able to move around resources and assets to ensure that we do enjoy the summer that we have. I'll be actually making some announcements about how we're further going to recognising the frontline workers in our transport system over the course of this year very, very soon. In relation to back to school, next week we will see the substantive return of our students. Nothing is more important to this government than the health and safety of our students. And we want to make sure that they have available to transport themselves to and from their places of learning. They deserve it, they need it, they're hungry for learning, that's quite clear. So that's why we will be going back to pre-pandemic public transport services for our students, with an extra 3,400 dedicated bus services to get kids to and from school, as well as an extra 200 train services to ensure that the back to school experience has got minimum disruption. I know as a parent of myself that there are a lot of mums and dads out there that don't want to expose their kids to the virus by using public transport. That's why they're driving them to and from school. I get it. Which is why I specifically appeal to those parents that live close to the schools. Think about walking. Think about riding the bike. The kids riding their bike. I find it absolutely frustrating this morning in my own electorate, seeing families that I know live within 1,500 metres of the school drive their kids to school. It's not necessary. If you want to make sure that your kid is mitigated, reduces the risk of being exposed to the virus, I don't blame you. So get them outside, get them walking. And there's no need to further clutter up our roads by driving just such short distances. Can I also highlight the fact that students will have their own obligations when they're using the buses and trains. They will be required to wear masks if they are of the appropriate age, namely 12 years and above. But you won't be thrown off the bus if you don't have one. I know kids can be forgetful, so can adults. If you forget it, don't panic. Don't walk home. Don't be concerned. You'll still be allowed on the bus, but you do have an obligation as a student to ensure that you mitigate the risk and you wear a mask. We hope that no child will be left on a street corner, but we know mistakes happen. I'm confident that the logistic plans that have been put together by Transport New South Wales are suitable. We'll see these kids back into a routine, which we hope will be a short-lived routine, and we can get back to the normal way of living.
Good morning, everybody. Our school speed zones are back. We know that in our schools they're in force right now. From 8 o'clock till 9:30 in the morning, from 2:30 till 4 p.m, they're in force. That's 40 kilometres around every school in New South Wales. It's a very exciting time. As a mum, I know for kids going back to school after the summer break, they're really excited. Some kids, it's their first time going to school. We know that they may not be used to using school crossings, and kids in their excitement can be very unpredictable. I ask you to please slow down. We all need to recalibrate after the summer and come back, check in, and know that when you're entering those school zones, you must slow down. That's why we have flashing lights at every single school in New South Wales. 6,500 flashing lights to warn drivers to slow down in our school zones. We also have additional schools crossing supervisors to make sure that our kids are helped across those driveways to enter school. But please, everybody, there's a really an array of warning signs, the flashing lights, the supervisors, the dragon lines as you enter the school road. There's a number of warnings to let you know, slow down, you're in a school zone. We want to make sure this is a great return to school for all our students, and those new students starting their school year, a very exciting time. I would love to have not a single fine for speeding in New South Wales. That would make my day. Please everybody check in, recalibrate and know that around our school zones it's a 40 zone from now, from this moment. We're really pleased that this government has invested additional money into our school supervisors program, so there are more people out there to help our kids cross the road. We make sure that we have those flashing lights, but we're asking you to check in again and make sure that you're slowing down as those kids, we know there'll be an influx of them going to and from school. Thank you.
Good morning everyone. It's great to be able to announce our back to school transport plan. Over the last 2 or 3 weeks we've been working very closely with our colleagues in health and education to ensure that every school principal and every school understands what our transport plan is. All my operators, all the people who are providing those services are dedicated to ensure that those 3,400 school buses, those extra trams, those extra school services on rail are out there to get kids safely to school and back again. It is very important to understand that we are working on the service plan, but also the precincts as well. As we knew last time, quite a few of those precincts get busy with traffic. I've got my transport commanders out there, a dedicated force from our police colleagues to ensure that we keep traffic flowing as well. As Minister Elliott said, if you can walk, if you can use your cycle and get your kids to school locally as well, that will be fantastic. The important thing for us is we'll be monitoring what's happening over the next few weeks with our Joint Operations Centre at the Transport Management Centre, ensuring that we keep every bus movement, every precinct moving, and making sure that we leave no school student behind. We welcome feedback. We're certainly working with operators and each school to understand how we can help them. Reminding also a few people that 1 or 2 changes have happened since the last time maybe your child hopped on board public transport. So look out for that. Remember transport nsw.info, and also our dedicated apps giving all the information for public transport, as well as obviously keeping an eye on what those dedicated school buses are. It's really important, obviously, to respect our staff. They've been working, as Minister Elliott has said, tirelessly to provide services throughout the 2 years of this pandemic. Respect them as they provide those services, and they will be delighted to welcome every school student back on public transport and welcome them back to school. Thank you very much.
Premier, in terms of a possible surge with back to school, last month the government was provided some modelling from UNSW that quite accurately said we'd see 25,000 cases a day in January. Has the government been provided any modelling about what the possible surge in cases could be once we add back to school in the mix?
No, but what we have are the scenarios in relation to hospitalisations and ICUs, and we, as we have done so today, provide information to the public in respect of how we're tracking against it. They are the most important numbers. The most important numbers are the pressure on our hospital system and ICU presentations, and that has been our focus. We've always said as we've moved through this period of time that we will change our settings, make those decisions based on the information that's in front of us. Obviously, as school goes back and as many people post-school start getting back to life again after the summer break, there is no doubt with increased mobility you will see increased case numbers. But if you look at where we sit today, particularly in relation to our healthcare system, hospitalisations and ICU, we are in a very strong position. As Susan has said, we have invested heavily, not just from the outset of this pandemic 2 years ago, but over the last 10 years in building up the capacity in our health system. And that's what sets the New South Wales health system apart from anywhere else in the country.
Do you still think we're on the downward slope then, or should people not be surprised if things do kick back up again?
I think the key word that Susan used was plateauing. We're seeing a plateauing in our ICUs and hospitalisations. We are seeing a plateauing in relation to case numbers. But we are moving through a next phase. I mean, if you look back through Alpha from Delta, I think the key difference here is we were going into lockdowns. When you go into lockdown, your case numbers are going to dramatically drop. That is not the world we are in today with a highly vaccinated population. The strategy that we have today, from a New South Wales perspective and a nation's perspective, is that we are living alongside the virus. And living alongside the virus means that there will be cases of Omicron in the community each and every day. And when mobility increases, case numbers will increase alongside that. So that is the transition that we have moved to here in New South Wales, in Australia and around the world.
Just on schools, the unproven schools after 2 weeks, that up. And secondly, what helps guys actually program, or is that information?
Okay, I'll deal with the first question. In relation to the rapid antigen test, what we have said is that we will provide for the first 4 weeks of school rapid antigen tests to parents and to teachers to be used twice a week. Now, as we move through this period of time over the next couple of weeks, we will naturally assess how the system is going and reflect on that, and if there are ways in which we can improve that system, we will. But we will have supply, like we will be distributing 4 weeks for the first 4 weeks of school for teachers and parents, but in terms of how they are administered, we will reflect on that after the first 2 weeks. Well, so the focus in relation to rapid antigen tests for bringing schools back has been a combination of work that health and education have done together. Now, the main focus has been through education. It's true to say the main focus has been through education, but that was the discussions that we've also with the Victorian government, because it's about instilling confidence in teachers and parents about going back into class on day one, term one. That's what that was very clear through the consultation that occurred with the Department of Education. It's clear that from the consultation that occurred with the New South Wales Teachers Federation, that's something that would help in terms of instill confidence in our teachers and in our parents. So that's exactly what we've done. As I keep saying, this is a confidence game. It's been a confidence game over the last 2 years. Whether it's business confidence, consumer confidence, confidence across the broader community has ensured that we've got through the last 2 years strongly, and it is complete focus. We've been saying this now for 6 weeks. Getting kids back in the classroom safely on day one is our number one priority, and we've done everything we can. It has been a massive operation right across the state. I want to congratulate every single person involved, even from Lynn Fox distributing these rapid antigen tests to some of the remote communities right across our state. This has been a significant achievement, what's occurred over the last few weeks particularly, and I want to thank everyone involved. But Tom, the basic answer to your question, it's a combination of both, health and education, because from a health perspective as well, we want kids back in the classroom. That's a very important part of this.
So can you
Yeah. No. And what we're saying to parents is we're being incredibly flexible. We're asking parents to use these tests twice a week. It's really important to keep our classrooms and schools in a safe environment. And this is about being flexible, having a common sense approach. As I said at the outset, if you can test your kids before day one, do that. If you can't, that's okay. If you can't get to school before day one, that's okay as well. We'll send those tests back. It's a common sense approach, and I know that parents right across the state want their kids to be in a safe environment, and everyone's made enormous efforts over the last 2 years. So this is not the heavy-handed government. This is government providing support to our schools, to our teachers and our parents so that we can open our schools day one, term one. And for my own circles, I know that many of my friends are incredibly happy that their kids are going back to school next week. I'm sure that's the case for parents right across the board. We're asking parents to make this effort. I know in certain circumstances that's not going to be easy, giving these tests to your children, but if we can continue that effort that we've done over the last 2 years, we'll get our schools back in a safe way.
Premier, it's been 13,000 positive tests across the state. That's a significant drop. Do you think that's a true reflection, or are people not reporting those positive doubts?
Oh, I think if I look at, and I get the numbers daily on the rapid antigen testing, it seems very much in line. There's a plateauing here across the board. It's hard to tell. We would obviously expect there to be more Omicron in the community that comes through either PCR testing or rapid antigen tests. For many people, you could have Omicron and have no symptoms at all. So unless you're actually getting a surveillance test, you may not even know you have it. So it's likely there's more cases out there. But having said that, it was very clear in National Cabinet yesterday, if you look at a proportion of the population, you're seeing other states now have higher numbers than in New South Wales. And that's only to be expected in circumstances where Omicron hit New South Wales before it hit other states. New South Wales and Victoria are trending at very similar levels, and now you're seeing other states on a population basis take over. But once again, I'd make the point that even just on reported numbers, it would be our expectation that as kids go back to school, as the year kind of commences, let's be frank, Australia kind of sleeps up to Australia Day and then kind of gets moving. So as we move through this period of time, we'd expect cases to increase.
Just on schools.
I don't want to go into details in relation to the National Cabinet discussions, but it's certainly a topic of conversation, and we're waiting on advice federally in respect of whether or not it would be deemed that 3 doses would equal a determination of being fully vaccinated. In the interim, we can't do any, we can't say it enough, get boosted. We would say that in order to be up to date with your vaccination, you need to have 3 doses. That's a term that people are familiar with. When we vaccinate our children, we have it's about being up to date. Up to date is 3 doses of the vaccination. We know boosters work. It is very, very clear. As Dr. Chant has said, Susan Pearce has said, we can't say it enough. We need people to get boosted to stay safe. Now, if there's a determination at some point at a federal government level, we'll take that advice from the health officials and accept it. I know that our health minister is also speaking with health ministers around the country, but we say it numerous times. We'll continue to say it every single day. Please go out, make the effort to get boosted. Our centres, our 40 centres, are there to provide that support to the pharmacist and GP network. Last year, when we're doing the vaccination program, the first 2 doses of vaccination, the system was under pressure, and we had pressure on supply. We don't have that problem anymore. We have those vaccines available for you. As Susan has said, and it's a really important point, what we do know is that many people are unaware, and that's probably because of being on summer break, that period of time is 3 months. So if it's been 3 months since a second dose vaccination, you're eligible for your booster, please make a booking. I think it makes sense. I think it makes sense because as the boosters work, it makes sense. But in the intervening period, as we work through this with the federal, with the federal health officials, I can't say this enough. Please get boosted. You'll be up to date with your vaccination program if you receive 3 doses of the vaccine.
Premier.
Look, there are natural challenges and issues in relation to concerns the unions have. They're working through that and putting pressure on, particularly further pressure on health workers and teachers. So I accept all those issues. They have to be worked through. But that message should not get in the way of the real message, and the real message is get boosted. Now, we'll take the advice from the federal health officials, but in the meantime, I will say, as Premier of this state, you're up to date if you received your 3 doses of vaccination. That includes your booster shot.
Premier, just on the boosters, for some multicultural groups who think they don't need a booster, isn't that?
Sorry, what was the last one?
For some multicultural groups who think that they don't need a booster,
yeah.
Isn't that poor messaging on behalf of the government?
Oh, Multicultural New South Wales is doing a phenomenal job. When you had a situation over the last 2 years, let's just take a step back. I think the clear issue here is last year we had a very deadly variant in Delta when vaccinations came out. We never believed that we would get to a 95% vaccination rate. That's what we've achieved. It's been a phenomenal effort from everybody across our state who has gone out and been vaccinated. Now we know in relation to boosters, we are really pushing it because we know that particularly people who have underlying health conditions or in certain circumstances for unknown reasons, the booster shot helps limit severe symptoms. Now, when many people have either had COVID or alternatively know people have COVID, have been vaccinated, feel, it's pretty clear, many people feel that with a less severe variant, that need is not there. As Susan has said, that cannot be further from the truth. Now, Multicultural New South Wales has played a pivotal role over the last 2 years in getting those messages out. They continue to do so. It's not just an issue in terms of our multicultural and ethnic communities, it's an issue right across the board. And rest assured, from a communications perspective, we are doing everything we can to get that message out. It's naturally a difficult time over summer when many people have gone away, they're spending time with family and friends. So in terms of messaging, what you can all do here today to help the messaging is on the news tonight, in the papers. Please continue to push the fact. Go and get your booster shot. We have the capacity in our centres, in GPs and pharmacists for that booster shot to be administered. We're doing what we can from a government perspective. Multicultural New South Wales is doing what they can do as they have over the last 2 years. And I particularly want to thank our ethnic communities and the leaders of those communities because they have been pivotal over 2 years as messages have changed, as rules have changed, as different variants of the virus have come through. Their communication to the communities across the board have helped keep people safe. We've just got to push to this final effort. Boosters are key. Completely relaxed about that. I mean, our job is to not, be populist here. Our job is to do what's right. That's the role of a government in a pandemic. I think we've seen over the last 2 years that as we move through the pandemic, there are different views at different times from all sectors. And there's no doubt when you've gone through an Alpha outbreak or a Delta outbreak or now the Omicron outbreak, governments get under pressure. That's okay. Our job and my job, day in, day out, is to not do what's populist, is to do what's in the best interest of the people of New South Wales. That's to keep people safe, to continue to get people boosted, to get kids back in the classroom and keep society open alongside the virus. By-elections will be by-elections. My focus day in, day out is getting the people of New South Wales through it. In aged care? Yep. Good question. Well, firstly, I'd say that aged care is a federal government responsibility. That's the answer to the question. But what I've said from the outset, when we went straight out of the blocks here in New South Wales and purchased 150 million rat tests, we would provide those tests to where they are needed. Now, we are working with our health teams every single day. Obviously, schools, when we're going through the priorities, and our healthcare workers, number one. Healthcare workers are number one priority. But right across government, and the transport guys are here today, transport, every area of government has an allocation. So we work through that. But I said from the start, if we can provide further support to the federal government, because we have access to those rapid antigen tests, I'm happy to help. We're happy to provide extra support for aged care facilities if they need them. We've procured what we believe is much more than we needed, because it's better to have than not have. And I'd much prefer a situation where we're sitting back some time down the track and we've got a whole lot of rapid antigen tests sitting on the shelf than to not have them at all if they're needed. So if the aged care sector needs further support, and we have the capacity here in New South Wales to assist the federal government in doing that, we will do it.
May I ask Susan Pearce a question just about the modelling? If you can give us a bit of a snapshot of how regional hospitals are coping in terms of capacity. Obviously, it's very different at St Vincent's versus Dubbo Hospital. Are we flying a lot of people to city hospitals, at ICUs, flat chat out there?
No, look, the regional hospitals are actually doing quite well. They're under pressure. It's not universal, so some of our regional areas are already really looking at their surgery plans because they believe that they're getting to the point where they're ready to bring surgery back on. Obviously, we need to think about that in a fairly uniform way. Flying people to Sydney, has not been a feature by and large at this stage of the pandemic and with our hospitalisations. So I think they've done an extraordinary job. And of course, we have been assisting wherever we can with staffing. So there were some examples, particularly around Christmas and New Year, where we needed to send some staff from other areas to some of our regional facilities to help them out. So our whole system has pulled together to do that. And of course, the other thing that they're doing, the same as the city hospitals, is working with their private hospital partners in those regional areas. One other point to make, I think, with respect to the numbers that you're seeing at the moment, what we're starting to see in the hospital data is incidental COVID. So the direct admissions for COVID are starting to reduce. But what we see, so if you were riding your bicycle and you happen to have COVID and you turn up at hospital and we admit you, we would count that as a COVID admission. We'd treat the bicycle accident. But so what you're seeing in the numbers now is that whole picture. So we've always counted everything. We don't want to, mess around with the data and say what is and what isn't. So we're certainly seeing a decline in direct admissions for COVID. It's quite a tricky space because sometimes an indirect, admission can be complicated by the COVID itself. But I think by and large, the beauty of the New South Wales health system, if I might say, is how networked it is. And what we've done during this period is to make sure that our rural areas are well supported by the metropolitan areas, and we'll continue to do that. So we're really proud of the work that they've done.
Those staff that you mentioned that you sent to the regions, are they still on the ground or have they been brought back?
No, look, it was very much associated with furloughing, and you'll appreciate that furloughed staff in smaller areas has a much larger impact. So someone who worked in Broken Hill for 10 years at the start of my working life in health, I know how much a small hospital can be under pressure just with a few staff out of action. So what we were able to do was to send people to help in those furloughed situations. It's been challenging. I'm not pretending that it's been easy to do that, but I would like to thank the staff who have selflessly moved across the state as necessary to help. By and large, our rural services have managed really well, but that's been part of our planning.
Sure.
Are you confident you've got enough operational staff able to work given the challenges of Omicron? And how much of a challenge has that been through the late start?
I think certainly the number of operational staff we've got available to us has improved. I think as the Premier was saying, we've seen the peak of the peak where we had almost 2,500-3,000 active cases within the transport family. That has reduced as people have come back to work after isolation and recovering from COVID, and we feel confident that over the next few weeks, but we're fully aware of the issue where if there is a spike, we want to make sure our staff are safe. That's why we're saying to people when they're travelling on public transport, please wear your mask, wear it properly. If you're waiting at the bus stop or at a station platform, please do that as well. And for kids, please make sure you're wearing a mask. I know over 12 you've got to, or 12 and over, but if everyone could do that, we're out there keeping the place clean, making sure everyone's safe, and therefore our drivers and station staff will be safe as well.
Just on last question, on capacity, I'm not sure who's best to ask, but on capacity for public transport, are you looking to increase that at any point soon?
Okay, at the moment I think what we're seeing is there's about 40% of the pre-COVID levels of transport out there, but it is still 850,000 trips a day. It's a big number. It's essential workers, our health workers, education, lots of good people who have to use public transport, have no choice. For the month of February, We believe what we're providing today with the schools now getting a weekday bus service with schools, that is providing service where we're not seeing overcrowding. But we're working with obviously a lot of people to understand what does March, April and May look like, and I'm still working with Minister Elliott. We will come back to you with the plan going forward for transport.
Premier, just on business support, are you considering providing any of that, knowing that many small businesses are hurting right now in what is essentially a de facto lockdown?
Well, firstly, can I reject the premise in the question? That is not the case. If you look around the cities, if you look around the suburbs, a lockdown, everyone seems to have forgotten what a lockdown was, what a lockdown did for businesses. To say that is just not correct. A lockdown, which is what the Labor opposition were calling for, a lockdown closed businesses right across the state. A lockdown caused 300,000 people in New South Wales to lose their jobs. That's what a lockdown did. And there were those decisions we made at that point in time when we had a highly unvaccinated population were incredibly difficult decisions for a government to make, because those decisions meant that we were putting many people, many families across our state in a position where they were going to lose their job and not be able to provide for their families for the sacrifice of keeping people safe. They were not easy decisions. And what we did at that point in time, from a government's perspective, was we provided as much financial support, more financial support than any other state in this country, by a long way. And we did that to keep businesses going, to keep businesses operating, and at the same time keeping people in work. And what happened? We recovered, of the 300,000 jobs we lost, we recovered every single one of them. In terms of insolvencies across the state, or bankruptcies that you would see in the ordinary course of an economic downturn, in New South Wales, we hardly saw that at all. And that didn't mean that businesses weren't going through a tough time. They were, and many businesses were closed. That's what a lockdown does to communities. That's what it does. In a highly vaccinated population, what we have done is we've kept as much of society open. I know that for many people, particularly over the summer break, as we've had to transition through this different period of the virus, from not going into lockdown and keeping society open, that confidence has declined. But confidence will return. We're already seeing it now. Just running around the city over the last couple of weeks, it was dead. Over the last week, I've seen it pick up. I've seen the restaurants and the cafes and the bars. People are having the confidence to go out again, and they're doing so in a COVID-safe way. They're socially distancing. They're meeting more outside. They're eating outside. Our businesses are transitioning across too. That's not a lockdown. Now, there are businesses, particularly over January, with furloughed staff, and with many businesses in certain circumstances for a certain period of time had to close. Now, I know the Treasurer, and we're working very closely with our counterparts in Victoria, because we're in a very similar situation, are working on a package that's tailored to support those businesses to help get them through. Because I've said, as the previous Treasurer of this state, through this entire journey of the pandemic, based on our strong fiscal foundations and economic foundations that we have set in this state over the 10 years leading into this pandemic, that we will always put our businesses and our workers before the budget. That's what we've done through this whole period of time. Now, that means that challenges down the line when we don't want to provide further challenges for generations to come. But that is the approach that we have taken in the past. That is the approach that works, and that's what we'll continue to do going forward. But lockdowns, this is to liken that situation, in my view, you should speak to businesses and workers who have lost their jobs over the last 2 years based on what we had to do during a pandemic to keep people safe with an unvaccinated population. And they were very uneasy and difficult decisions that we had to make, and they were incredibly unpopular. But once again, we talk about popularity. They're incredibly unpopular, but they were the right decisions to make in the circumstance we found ourselves in. Now, as we've moved through, there's no doubt there is a transitioning of a mindset. Going back to school on day one is key to shifting that mindset as we move through. But this is the new phase. This is the new phase of living alongside the virus. And that means we keep businesses open. We keep society functioning. And the public will come on that journey. And we're seeing it now as we've moved through this period of time. But we will continue to provide that financial support to keep businesses going, to keep people in work. And last point I'd make, passionate about this, last point I'd make is in relation to the health system. Because what you're seeing not just nationally, what you're seeing globally when it comes to the pandemic response is that those governments that set up their health system, that set up their economies and set up their budgets for success going into this pandemic are the ones that have had better outcomes. You can't just turn your health investment on. We're seeing that in another state right now. You can't just turn that on. You have to invest years after years after years, and that's what we have done since coming to government, in investing record amounts in our health system, in increasing our health capacity, in increasing our nursing and frontline health staff. That's what we did. We've seen that in budget management. We have an opposition that's opposed every single budget management over the last 10 years in government. Every difficult and unpopular decision this government made to get the budget in a strong position, opposed by the Labor opposition, every step of the way. That success financially and economically has allowed us to have the firepower to invest more than any other state around the country to keep people in jobs, keep businesses operating. That's been the success here in New South Wales, and it's a standout success. Doesn't mean we haven't had challenges. We're in a 100-year pandemic. There'll always be challenges. We won't always get everything right. But in the main, the response in New South Wales has been incredibly strong because of the foundations we laid before this pandemic began. Thanks.
Can I just quickly comment on that without
Last
test?
question.
Has
Yes.
anyone been fined for failing to report a positive test result? And if not, do you stand by that fine's decision?
Well, someone getting fined is not the sign of success. We made testing mandatory because we wanted to send a strong message to the public that it wasn't an optional. It wasn't an optional decision. It's important. I was asked an earlier question in the press conference in relation to how much Omicron is there in the community. Well, the best thing that we can do in determining that is have high testing rates. That's what we've had over the last 2 years. The efforts that people have made in going out and getting tested has kept our community safe. And now, as we move to the rapid antigen tests, which sits alongside still our PCR tests, which, by the way, are now coming back on around 24 hours. That's going very well. Our rapid antigen tests, we made it you can't make something mandatory and not have a fine. That would have been the other question. It wasn't about the fines. It was about sending a clear message to the community that we want people to ensure they upload their rapid antigen tests. I'll check on the answer. My expectation would be no, and that's what it was always going to be. That's fine. That's not the point. The point is we want people to know we need you to upload your rapid antigen tests, particularly as well for our health teams. Because our health teams, by uploading your rapid antigen test, what it does, if you have any underlying conditions, it connects you with healthcare. So that's why we did it. If we didn't do it, if we didn't make it mandatory, then people wouldn't feel the need to upload those rapid antigen tests. We wouldn't be able to connect people to healthcare. So whilst decisions that you make in a pandemic are criticised from here and from here, my view was it's the right decision. We stand by it. Thanks.
Thank you.